On a topic of personal interest, Dr. Clifford, you mentioned the continued importance of traceability. The context of food system biosecurity, what are the next key priorities in the evolution of our nation's ability to trace all animals throughout the production chain?
This is still a very key area for us, and we feel like, you know, from the standpoint of group lots in the poultry industry, the swine industry, we feel like we've got really good traceability. Due to the scrapie eradication program, there's been very good traceability within the sheep and I think the goat arena. With regards to the dairy industry, it's pretty good traceability. We still need a lot of work in the beef sector. It's improving based upon the new rules with regards to the breeding side, the breeding herd. But I think also with the traceability section under Robert over there, when we talk about traceability, when Jack probably wants to add some things maybe to what I was saying, but basically the full traceability is still lacking, and the timeliness, while it's been reduced from weeks and months to maybe a few weeks, or in some cases maybe a week or less, in an infectious disease process, it's not fast enough, and it may not be fast enough even if you have the best. So we got a lot of work to do. I know we agreed with the industry to have a voluntary system for the feeder industry, but it's impacting trade. It's one of the obstacles with China. Jack, I didn't know if you wanted to add.
Yeah, I'll just add a couple of things. We just finished a big meeting that we had with our animal health technicians and our animal identification coordinators, and we talked about what's working out there. And one of the things that we don't have, as John said, is that we don't have a coordination of when the animal was identified, where it was identified for, and where it was slaughtered, and we can't seem to coordinate and get that information. And that's what these companies, China wants. That's what they want. They want to be able to say, here's where the animal was born, here's where it was finally processed. And if we can't do that, it's going to affect us in trade channels, not just here. And we feel that trade will drive this thing. So our initiatives are going to be to push more of the radio frequency type of tagging, and to use ultra high frequency and low frequency tags as much as possible, to work with the markets and the buying stations and the state representatives to try to get that. Everybody that's tried this technology likes it, and it works, and it will allow us to do this, the beginning and end point tracing of these animals. Without that, our industries are going to be kept out of a lot of markets, and we're starting to see that already. We want to get there, and we want to find a way to show the economics of these tags, that beyond what it costs for the tag is $1.40 or $1.60 a tag. When you market and work these animals and all the processes that work with the radio frequency and the time saving that it allows in just plain labor will pay for the tag. So we're gonna try to go that direction. Our push for financing is going to go that direction. We want the industry to come with us. We want to talk with them about this. I think we can demonstrate that this really is a cost-saving issue. It's not going to be required, but until we have something on those lines, we're going to be kept out of several markets. And that's really, I think, the economics of this and the marketing will push this for us. Much like we used to slaughter a 200-pound hog. I think now they're slaughtering a 260 to 300-pound hog in the slaughter plants, because we can raise a leaner hog, we can grow them bigger, and they're not all fatty. Industry pushed that, the marketing pushed that. It wasn't the individual producers. That's it.
Thank you. Any questions from the floor? Or?
Good morning, Dr. Shere. I'm Robert Cobb, state veterinarian from Georgia. And how about we do away with the news tags? And instead of providing them as a free tag that everybody can use, how about we stop doing that and provide RFID as a free tag to state programs?
I think we discussed that at the meeting I was talking about, and the ability to, I mean, the cost of a news tag is 6 cents, 3 cents, somewhere in there. The cost of an RFID tag is, like I said, between $1.20 and maybe $1.60 if we can get that price at that. We consider that. That's things we're thinking about. We could do that through cooperative agreement processes. There's ways to get this done, but we need the industry to agree to do it too. We can support it to a degree, but it's not going to cover all the cost of doing that. What I've encouraged our folks to do is pilot programs, go out and show people how this works. Every place that we've worked with industry, like the markets, they've loved it and wanted to keep it. I mean, the idea that you can walk cattle by a wanding system, and their total ID is 10 at a time, 12 at a time, 20 at a time. It's recorded. They're so sensitive in some cases that you got to keep the tags away from the reader when you're doing the information. So I think this is the way of the future. We've got to become more technologically sound. To read a news tag is very difficult, and we found that they're just not gonna. We're not gonna be able to trace those. Right now, our trace system, we're getting close to 48 hours on a trace, but that's 87% of the animals that are identified. That doesn't mean they're all identified.
Yes, my name is Mark Thurmond. I'm from UC Davis, retired. I had a couple comments I wanted to make about the FMD plan. As Jim knows, I'm not a fan of it. I don't think it considers what we know about foot and mouth disease, the symptoms and signs. That typically they mimic conditions that we see every day on dairies and all kinds of animal facilities. Diarrhea is very common for those who have clinical signs. Many animals don't even develop clinical signs. So they can continue to spread massive amounts of virus, contaminate the environment. And so when we say that we're not going to really prevent any movement from these animals within a quarantine zone, seems foolhardy to me, especially when we know that these animals can spread the virus for weeks before they're even diagnosed. And I think, as you noted with the high-path AI, it's critical that the virus load in these facilities be reduced as soon as possible. So that seems to contradict the plan for FMD, which is that they would not be able to depopulate these herds because it would be, some of these animals, some of these herds are just so extensive. So I think that's a contradiction, and you really need to sort that out. But with FMD, we need to really get rid of that virus as soon as possible and to kill those animals. The virus doesn't do well in dead animals, as we know, so we need to get rid of that source as soon as possible so that birds and other fomines aren't going to spread it to all other facilities. I think that the key to controlling this is going to be reducing transportation as much as possible, which obviously is going to go against the desire to maintain business continuity. But I think the question that the industry needs to face is, do they want an extended outbreak of foot and mouth disease that results in endemic disease, long-standing, long-term, sustained infection with FMD in the country, elimination of foreign markets, or a heavy investment up front to deal with the disease? Dr. Clifford's comments that the UK experienced this terrible devastation of disease is correct. The reason that much of the concern about the UK was because so many uninfected animals were killed. That's because the government relied on a flawed risk assessment model, which said that they had to kill all contiguous herds next to an infected herd. The diagnostic lab in Pirbright was directed not to do any diagnostic work, and so a huge amount of effort went into killing uninfected herds. Obviously, we don't want that, and so one of the keys is going to have to be extraordinary efforts at diagnostic testing. And that's where I think the surveillance needs to consider more laboratory work as opposed to on-farm observation of clinical signs that really are going to resemble typical diseases that we already have. Thank you.
Thank you, Dr. Fuhrman, for your comments. I'm going to start, and we're probably all going to take a whack at this. Our process, when it comes to FMD, if we find it soon enough, is going to still be stamping out. Or if it's small enough and we can get on top of it, we're going to go in and stamp it out. When you go to we went from a vaccinate to kill policy to a vaccinate to live policy within APHIS. When you go to that policy, it's a strategy to try to save as many animals, and as John said, as much protein as possible. As Dr. Roth said, some of these animals, especially cattle, will recover. But we'll be vaccinating, ring vaccinating, coming in at those animals, and all those animals will eventually be destroyed. So our goal, as you said, is to get back to a status with the OIE where we're free without vaccination as quickly as possible. That would be the direction we would try to work. And your comments about surveillance and diagnostics are all right on. We have to do that. No doubt about that. And we continue to examine a way that we can develop a vaccine strategy even to meet the needs of the United States and the industry, and how that's going to come. It's not going to come from the federal government paying for the vaccine. We have to have a partnership that gets us there. And that's the discussion that needs to be had quickly and has to be decided soon.
Sorry, any other comments?
Yeah, there is.
Sorry, hang tight 1 second, sorry.
So the plan that's been developed working with state, federal, industry, and academia, when we started working on secure food supply plans for FMD, there was a recognition that stamping out is the way to go. We've had 9 outbreaks in the U.S., and stamping out has worked every time. Of course, that was between 1870 and 1929, when there weren't many animals and not that much movement. But with the structure of our modern livestock industry, we could get to a point where the virus is moving faster than our ability to stamp it out. There could be control areas around all of those, a lot of animals with no movement. And if you have no movement, you're going to have to kill a lot of animals. So that there was a phases and types document of how to respond to an FMD if it grows and gets out of control. And it's basically based on what's possible. When it becomes impossible to stamp out, then the incident command in that region may need to allow animals to recover. And then how do you show lack of evidence of infection? And I think that's what Mark is talking about. One of the things we have in there is, of course, PCR testing, but that doesn't prove a negative. It's useful for finding positives in the FMD world. Active observational surveillance to look for abnormal symptoms. And of course, FMD can produce diarrhea and other typical symptoms. So what we're looking for is not one case of diarrhea or one case of mastitis. It's a pattern of disease that's beyond the normal. And that would trigger that producer to call in a veterinarian or an incident command official to look at the animals and try and have a judgment. So it's no doubt complicated and no doubt imperfect, but it gets to the point where you do what you can't do what's impossible, so you have to start doing something else.
And just to add, as already stated, you know, our goal is to stamp out and get free again, not to allow movement from affected premises. But in this ring vaccination area, animals that have no clinical signs may have been a dangerous contact, to try to move some of that product safely in a safe way. And if we can't do it, then fine. But if we can do it, we need to utilize that protein. We can't kill 40 or 50 million animals in this country and dispose of them in a timely, effective way. We're going to have more virus out there. So we've got to, if it's really spreading quickly, we're going to have to use vaccination as a tool to help us control this disease. And then, after we control it, then start to move to get rid of those vaccinated animals.
Thank you. All right.
Keith Rohr, Colorado Department of Ag. What do we know about the traceability expectations of China and other trading partners? Are they looking for demonstration of traceability through verification programs that we can do from farm to fork, and a lot of those function today? Or are they looking for a more comprehensive system that may be nationwide that we're trying to demonstrate through performance standards?
Right now they're looking for identification at the birth location, and for you to be able to trace that animal from slaughter back to that location. That's what they're looking for. You've got to be able to verify. Now, whether it doesn't mean that it necessarily, as long as we can verify that back, that's the most critical component. But I think, you know, in our initial work, I think we need to make a strong statement to China that we have the capability to do this. And Keith, we have people that have been working on this issue. Neil can maybe speak to it at some point in time during this meeting. And I know Foreign Ag Service is getting ready to send to China what we're proposing to be able to meet their needs.
Talk about them coming over to audit us.
So there's a bit of a follow-up on that from one of the cards that were submitted. From a traceability standpoint, who should be responsible for a functioning and complete infrastructure? Tags are one thing, tracking and tracing are another.
Well, we've always ran that as a combination of a partnership between the states and the federal folks. The way it's set up now, the states sort of have the responsibility for the database, and we utilize that database. They can set that program up and that tracing up however they want it to be and use whatever system they want. We haven't specified that. We just want to be able to get into that system and trace in the event of disease. So it's a partnership from that respect. We haven't dictated to the states this is the way we want it done, but it has to have certain aspects so we can trace back. And that's the way the partnership has run. Our folks are responsible for interstate movement. They're going to enforce those interstate rules. The states enforce the intrastate movement rules. To me, it's one and the same. And we need to work together to make sure that animals are properly identified whenever they're moving so we know where they're going.
Thank you. Robert?
Thanks, Glen. Robert Fordrain. Was interested, Dr. Clifford, where you look at the past, the present, and the future. We all know it's election season. Money will be tight. Whoever wins the election next year. Agriculture obviously has some challenges as far as disease outbreaks. And are we looking down the future in a different direction, or maybe we should focus those dollars on disease prevention and looking at means of strengthening our different livestock species' abilities to ward off some of those diseases? I understand there will always be the reactionary part, but should we look at using some of those precious dollars and looking at new technologies? And I'm referring to what we saw with the pork industry, where we can look at the genetic side of things and see if we can make animals resistant against certain diseases.
So, Robert, all of these are good points, but there are limited dollars. So when we were just talking about FMD, in order to build a strong FMD vaccine bank to be able to address FMD on the needs, we're going to need more dollars for that. And if you look at Jim's paper, you're talking a huge amount of dollars. We need comprehensive surveillance in this country for all species. early detection. Harry Snelson, Harry, where are you? You were around here. Harry, in discussions with us on PED early on, Harry said, you know, John, it doesn't matter what disease it is, you're not going to be able to detect it soon enough if you don't do more laboratory work and pay for it on the front end. So all of these things are needed. So my question is, what is the top priority? You've got antimicrobial resistance issues. You've got all of these things. There's not enough money. So we're going to have to pick and choose what is the most important and try to do that. One of the things that the industry has done very, very well on the plant side is in the Farm Bill, they got money to help at the state levels with a lot of these issues. The animal side needs to unite and do something very, very similar.
I'm going to add to that. The plant folks went out and in the Farm Bill, they get $70 million a year to take on these initiatives and to do the kind of work that they need to get done. As John said, we'd like to see a direction for a similar process in the Farm Bill for the animal side of things. We in VS and APHIS put an initiative forward and asked for preparatory money so that we could be prepared for the after HPAI hit us. What better time to ask for specialized funding than after something like that? And we asked for that, and Congress has, at least in the President's budget, we think we're going to get some funding to address preparation. And with that funding, we're going to rebuild and restock. Beyond the 300 folks that you saw that were on emergency funding, those folks have 1 year with us, and then we have to let them go. We'd like to retain some of those folks, and with this funding, we hope to use that to get prepared and put on new staff and have further reach. Our field force has been devastated since 2010. We've lost over 200 positions. We hope to rebuild that, and it's important to us. We've lost, what's the number that Kevin Shere always uses? How many $1 billion in our allocation over the years? That's coming back slowly, but we've been flat for many years. So to ask us to do additional things without additional money is very difficult. And new initiatives come all the time. AMR has come, Global Health Security has come. Everybody wants us to work on these things with $0. It's kind of hard to do. You have to pick and choose what you're going to get done. And when high path hits, that's what you pay attention to. So we want to be prepared, just like the rest of you folks. We want to be able to assist. But as John said, I think if we need your help to initiate something like that in the Farm Bill, and get us prepared so that we can not only help ourselves, but help you help us.
So as a bit of a follow-up, one of the cards from the audience continues on the cost question. This is for Dr. Roth. Has any cost analysis been done on the biosecurity plan and its impact on the average size hog or poultry contract grower?
Not that I'm aware of. I haven't seen that. It would depend on what they're doing now and how much they would have to change, but I haven't seen any cost analysis of that. As I said, biosecurity is expensive and it's inconvenient, so there will be a cost.
Thank you.
Jean-Pierre Vaillancourt, University of Montreal. This morning I heard a lot about on-farm biosecurity and also planning in case we detect something in a region. In order to react quickly, but I didn't hear much about the regional approach to biosecurity when there's no infectious disease detected in terms of companies communicating and basically applying biosecurity at a regional level. Is there anything happening right now in your planning regarding this?
We haven't approached that as regional biosecurity for the foreign animal diseases. Obviously, it'll start in a small area and may become regional. I know the swine industry is working extensively on regional elimination programs, PRRS elimination, and other regional disease elimination programs. If we do get FMD or classical swine fever that gets out of control, then the focus is going to have to be probably on regional control to suppress the disease and eventually eliminate it.
What we have seen is, as a result of high-path AI, it goes to the individual farm preparation. What can you do on your farm for disposal, depopulation? What facilities do you have? Build that plan first. Put that into a state-governed plan, a statewide plan. Build that then into regionalization. We have to make those steps. In some states, we didn't even know if we could where we could bury what could be buried. Other states have that all ready to go. So we have some planning and some work to do, and that all requires that planning to be done in advance of the next outbreak. And to me, when I walked on farms and they had 3 large laying facilities on less than an acre of land, no place to go with their birds, we got to have a plan for that farm about how we're going to deal with an outbreak of disease on that farm. So all that has to build and be put together, in my opinion, for us to get to regionalization. One place where we are working hard on regionalization is trade, and being able to regionalize our country in the event of an outbreak down to at least the county level in some aspects. And we've worked with many of our trading partners in the HPA outbreak. Despite the devastation that we maintain, 84% of our trading partners didn't close us down. 4 or 5 said nationwide, we don't want anything, we don't care. So that's part of why regionalization, that concept is being utilized, not for disease control purposes, but for trade purposes, and I think we can build off of that.
So I'm always reluctant to shut down good discussion, but I'm going to take another 2 questions from the floor, and then we will break as scheduled. Committee leaders, I'll ask you guys to reset the start of the species committee meetings to 10:15. So it's going to give us a little bit of a gap to allow for a proper break for everybody. So again, 10:15 for the species committee meetings, and now we'll move on to our last 2 questions.
Thank you. Good morning, gentlemen. Ernie Birchmeyer, Michigan Farm Bureau. I have a follow-up on the infrastructure response and then a question regarding indemnification. In terms of infrastructure, Dr. Clifford couldn't agree with your comments more about the need for traceability in this country. To Dr. Shere, though, if we continue to allow states to make their own decisions, not that that's a bad thing, but will we not then generate a patchwork of readability systems across the country that don't communicate with each other? Do we need a national type of infrastructure reading capability that allows us to have a true traceability system? Again, tags are one thing, but if we can't read and follow the movement of animals the way that we do across the country, are we not doing ourselves a disservice? The second part of the question then, in a disease outbreak, are we prepared, or how do we come prepared to deal with indemnification when we have more than one disease outbreak at a time? We know the avian influenza outbreak cost $1 billion. At the same time, we had other regional disease issues that were delayed in terms of indemnification to farmers, people whose lives and businesses are at stake. Ultimately, we have to be prepared to get these people back in business, and are we able to do that in a timely manner so as to cause the least amount of disruption to the people's lives as possible? Thanks.
I'll take a stab at it and then turn it over to Jack. By the way, Jack is not acting. He's now the Deputy Administrator and Chief Veterinary Officer of the U.S. So to your point on the indemnity, it depends upon what you mean. Like if you're talking about TB or traditional programs, there are limited amounts of money for those programs. We can, in some cases, request additional funding through the CCC request, but the CCC request is really for emergency type situations such as high-path AI. But yes, that's available for multiple type of disease events if you have those occurring. So that is something that can be done. That doesn't necessarily mean you're always going to get that funding. You have to request it, and the Secretary has to approve it, and then OMB looks at it. To the question about the patchwork, yes, we need a system in the U.S. that we know is reliable, effective, extremely timely, and all of the above. in our negotiations, in which I was very much involved with the beef industry in this country, we agreed to take this approach and move things gradually. If the industry and the states support a more aggressive timeline, I think it's going to be very important for the industry to take the initiative itself to help drive that.
And we've got one final question.
Yes, Bob Diop, West Texas A&M University. First, I want to applaud USDA and Iowa State for their progress in looking at how we'd handle FMD in a beef cattle operation. Where I'm from, a prototypical beef cattle feed yard would be about 55,000 head. That would take 7 days to depopulate, more than 11 days to bury, and that's something that's not going to be very effective. So the idea that at some point we might have to move animals on through the whole process to come out on the other side is something that for some time we've not been able to see another way to do. On the regionalization, the Texas Panhandle has the Integrated Management Zones and Routes and Ports Plan, which is the regionalization of handling 3.5 million head of beef cattle, 700,000 head of pigs, about 500,000 head of dairy cattle. So we've got that set up. My question is going to go back to tuberculosis, so a little bit of a different thing. Maybe some of you are aware, but we've got a significant TB outbreak in the Texas Panhandle right now. A little bit concerned about our 10,000 head and 40,000 head dairies, and what are the things that we can be doing about that?
We're aware of the outbreaks in Texas, and we're working with the industry and with the farms for that. As John said, we get an allocation each year, and we get a certain amount of money for indemnity. These large dairies, 4,000 or 5,000 head, cost millions of dollars to depopulate. We have gone to the well for emergency funding many times for the depopulation of these farms. It's interesting, every time we do, they say, well, where's the emergency? And why are you coming back again? And this seems to be recurring. If it's a recurring situation, they want us to build it into our appropriation, but you can't. How do you plan for depopulating herds in the millions of dollars? The challenge for us is to have a program that's effective, to deliver that program, and to deal with the disease. As you said, and it's quite obvious, we don't have the funding to depopulate these animals, so what we're going to be faced with is the choice to test and remove. The current herd that we're looking at, perhaps 17 tests are needed if everything goes well before that herd will be released. That's going to be a long time. There's still the idea that you have to purchase the animals within that herd that test as reactors. That's extremely expensive. It's an ongoing situation and the continuity of business, the farm has to be able to move and profit. All those issues are on the table. I don't see us going back for an emergency funding request until this begins. It'll build, and we'll eventually get to that point. We've done that with other programs. I don't see that happening right away, but I see it'll come based on the push that we get from the industry itself. And John, do you want to say something?
Yeah, I just wanted to add one thing, Jack, on the biosecurity aspects of it. And I'm not talking about the cattle, I'm talking about the people. You need to make sure people coming into your operation don't carry TB themselves.